Hi, I'm Fred Cooper. I'm a research fellow at the University of Exeter's Wellcome Centre for Cultures and Environments of Health. I'm a historian of medicine, mostly interested in loneliness, solitude, mental health and shame. And I've collaborated quite widely with philosophers, sociologists, psychologists, literary scholars, and of course, other historians. Perhaps counterintuitively, working in this way has considerably sharpened my understanding of precisely what history as a discipline has to offer in the study of complex present-day health challenges. For me, problems like loneliness and mental illness require vast cross-disciplinary collaboration to even begin to unravel, and none of that is possible without history's distinct contribution, showing exactly why and how we are where we are. That said, multidisciplinary working can be awkward and difficult, and throws up a number of serious challenges for researchers, both individually and collectively. These could be methodological, practical, ideological, ethical, or interpersonal. As you might have guessed, I really like multidisciplinary work, but I also think we have to get away from what can sometimes be an almost fetishization of it as like an unclouded good, rather than something that frequently goes wrong and that has to be meticulously worked at. Before embarking on a collaboration, you have to ask some searching questions over whether your perspectives are actually compatible. You need some friction, some tension, but there should be agreement on significant intellectual or ideological points and mutual respect for one another's work. Also very much worth mentioning are different expectations for what collaboration will actually look like in practice and what kind of outputs will be most useful. More than anything else, these factors will govern the success or failure of the collaboration. Oddly, I've sometimes found this hardest to talk about, but you should really be able to articulate exactly what you do and don't want from something you give your time and expertise to. My top tip, if I have one, is to treat multidisciplinary work as a methodology in itself, with the main principle being communication. Is there a genuinely good basis for collaboration beyond the assumption that multidisciplinary research is a good thing to do? Why them? Why you? Why this? Have you set out expectations on theorization, contributions, authorship and outcomes in close detail right from the start? If the answer to that's no, you could be sleepwalking into all kinds of problems. And do you feel able to revisit these questions and any others that arise as the collaboration progresses? Finally, if you're writing together, get a Google Doc and don't track changes. Thank you for listening.